Number 6, presentations. A, monthly update, Martha T. Berry Medical Care Facility, Kevin Evans, Director. Good afternoon, sir.
Good afternoon.
Yes.
Only if you want to be heard.
Or understood. Heard or understood, one or the other. When in doubt, blast.
All right. Well, thank you very much. I did miss last month's meeting. It's great to see you all again. I was attending the Medical Care Facility Council meeting, and there's some things that I learned that have some direct impact on us in the long term. One, the payment methodologies for the medical care facility look like they will be changing by 2022. We're just beginning to get some information on how that would look, and I'll share, of course, with you as we go. Also, they discussed the Affordable Care Act replacement program that was currently on the table, and that has some risk of about $700,000 annually to us as well if that passes as it stands. The third thing that I learned has to do with our certified public expenditure. As we had talked about before, we're going to be using a portion of those monies to help refurbish the facility. The board has recently approved about $400,000 in improvements to our what they call access control, which is our door safety and security, as well as to our 17-year-old call light system. We are looking at our video surveillance as well with some of the new rules, and we have retained an architect to help us upgrade our kitchen, which was not updated at the 2000 when they did the renovations at the front. So we do have a kitchen dining room architect. We just signed on with them. We will be beginning some of the draft of the scope of that. I'll be updating you monthly as to what's happening with that. And of course, before we put any shovel in the ground, that would have to come to the commissioners for final approval before we make any changes to the county's building. But I just want to let you know that we are in that process right now.
All right, thank you very much, Kevin. We need a motion to receive and file. We have a motion by MyJack, support by Toko. Any comments or questions? I look forward to the updates as we move along. Yeah. Yes, sir. Chairman Smith.
Thank you, Mr. Chair. Kevin, you spoke a little bit about the kitchen renovation thing, and we've had some conversations in the past about looking into, with the whole Meals on Wheels and different things. And I'm just wondering if you've had a chance to get together with anybody about this, if there's a process going on where you're seeing if, I know you had more room in your kitchen to expand to increase your capacity if it were to work out for the better of maybe a Meals on Wheels program to maybe be able to supply them. Where are we at with that, or have you had a chance to talk to anybody yet?
I have, yes. I've actually spoken with our kitchen manager and looked at some costing of that. I also talked with Plant Moran as to how it would impact us. As you know, if we use our facility for anything other than direct care for our residents, that square footage has to be disallowed. So we have to make sure that in the long run, it is a sustainable model for us to be able to assist. And we hope to be able to assist with the Meals on Wheels as moving forward. In speaking with Plant Moran, what we found out was if we actually started it right now, it would not be a good thing for us financially. But I do believe it's a good thing to do if we can afford to sustain it, because as the new reimbursement models come, it'll be beneficial for us to have even a small revenue stream that is in addition to what we're doing right now. So we're looking at those numbers. I'm actually meeting with Plant Moran again to talk about some more of those numbers right now. The biggest challenge that we have to that is our legacy costs. As Plant Moran explained it to me, we have a large dollar amount in per day cost that is related to our OPEB and our pensions that finally stopped in 2016. So how do we make sure that we can still honor our obligations to those that have worked for decades in the past, as well as those that currently have those, and still be able to sustain assisting the county with the Meals on Wheels. That's what we're going to be looking at. So it's a little more complicated than this is our food cost, and this is, this is what we can do it for.
Okay. Happy to hear you're looking into it. Thank you.
You're welcome.
Thank you very much. Commissioner Brown?
Thank you. There was no attachment, no written report on the agendas you normally give us. Is there a reason why you didn't submit anything written to the board?
Yes, because I didn't do it.
Okay.
I do apologize for that, Commissioner. We have had a singular focus in the last couple of months. It's a bit of good news, bad news. End of May, I'm pleased to say that our facility reached a 3-star rating with the Centers for Medicare and Medicaid Services, which was pretty exciting to us. However, the day after that, we received our annual survey, and we did not perform well. We had several, actually a total of 20 citations, most of which were low-level citations of individual people just doing things the old way. But we don't know how that will impact us. Pleased to say that we're headed in the right direction, though. It was exciting to see that we reached a 3-star a full quarter before I expected to be able to do that. And that has a lot to do with the team's effort. But the reason that I did not come with a presentation that was on the screen is my singular focus has been on getting us back into compliance. How that works is we have a window of days that we have to come into compliance with, and the survey teams have not returned yet. So they expect 100% compliance with everything that we say we are going to do in our plan of correction. Right. If we are out on one of those items, for example, if we say we are going to survey something 24 hours a day and we survey it 23 on one day, we are out of compliance. So that requires a focus that is remarkable. Even so, we still must maintain our day-to-day activities. And we can't just say it's our plan of correction only. We still have all the other things that we were doing well that we have to make sure they stay in place.
Well, I assume that, so next month you'll have a report and you'll go through this in detail.
Yes.
I've got great confidence, I think the board has great confidence in what you're doing over there, but, it's important that we get those because I value them anyway.
Well, thank
So,
you.
thank you.
Thank you.
Thank you, Mr. Chairman.
Thank you. Next we have Commissioner Toko.
Thank you, Mr. Chair. What is the current census at the facility?
We have 197 right now. And that is significantly lower than it has been in years past.
Yeah.
It is still higher than the county average. Right now, we are averaging about 90.5%. The county is averaging 83%. And that comes out of the Certificate of Need section of the state of Michigan. They publish those. And we had discussed this in the past. The reason that we're having that downward pressure on our census is due to a number of external issues. We have more competition from assisted living, that is bringing in, they do a la carte services for people that are nursing home eligible. We also, and then they bring in other services from the outside. We also have, and as you know, in the county, we have a number of assisted livings that are building. We also have downward pressure from CMS to not have people go to nursing homes. So
Right.
that is something that is pretty clear and consistent. So as we're looking at what's happening with our systems, we have to make sure we recognize that's what's happening and begin looking for other revenue streams so that we can maintain self-sufficiency as much as we're able to do. Right now, we are managing the census, which is keeping our costs in line. We are very close to our budget. The only thing that put us on the negative side of our budget was some write-offs we had from 2010 to 2014. We're going to have some more of those old debt that was not reconciled. We're going to keep fixing that because it just makes sense that we understand where our money is. But we're in pretty good shape on financially right now.
What's the capacity?
217.
217?
Yes.
And how long have you been at this level?
We fluctuated on that all year long. The 90.5% is our year-to-date census. We were at 92% last year. The year before that, we were at 93.5 plus.
Okay. I recently visited the adult daycare at the Reculum building.
Mm-hmm.
I was not aware that that department had been shifted over to, under your umbrella.
Well, it has been for as long as I've been there, so I don't know
Okay.
when it was shifted, but I do know that I'm directly accountable for that.
Okay. What's the census in that program?
We have 23 in right now,
And what's the capacity?
just under 50. They say it's 50, but I believe it's 48 or 49.
Okay. And are you operating still 2 centers, or is it just, are you doing the south end of the county as well?
No, we're
Just-
only doing the Reculum building.
Okay. And how is that affecting the budget? What is the impact of that when you have half of the amount that you can?
Well, that one always has been managing the census, so that's a break even for us.
At 23 is a break even?
Yes, because we manage with census on that. Our number one expense there, of course, is labor. So we have the right number of staff to be able to manage that properly.
Okay. All right, thank you.
You're welcome.
Thank you, Commissioner Toko. Kevin, can you verify what's your break even as far as census, as amount of people at Martha T?
At the skilled facility, our break even, all else equal, is 201 now. It used to be 205, but we have been working on some cost reductions. We also had that revenue increase last year that helped us with that. So 201 is our break even. So I do have to constantly make adjustments on staffing to make sure that we stay break even.
Right. Okay, very good. Any other comments or questions?
I do have one question, Mr. Chair.
Oh,
And
you
forgive me.
never pressed the button.
I did, but I withdrew it a couple times too, because a couple times my questions were answered too, but I do have one. Yeah, I know it's a different demographic, it's an older crowd. What about, is there any issues, we hear about the opiate crisis all the time. Do you guys find an increase in even in that age demographic where you're treating folks for issues related to like addictions of any sort? Do you see that? Well, I know, I heard that.
We're all kind of sorry.
Yeah, I know.
We're actually that's one of the areas that we discussed at the conference about the risk of that. We are not equipped to handle substance abuse
Okay.
Consistently. If they have substance abuse and they are also physically unable to move, then we can assist them with that. But the one thing that we cannot is aggressive exit-seeking behavior and the challenges that come from somebody that is opiate dependent. They can be aggressive. They can be very tricky. And our staff is trained to give people choices, and that's something that you don't want to give somebody in a substance abuse program. So we just don't accept them.
Oh, that's fine. I just wanted to know. Thank you, Mr. Chair.
Thank you. Any other comments or questions? Hearing and seeing none, we have a motion and support to receive and file. Vote, please. Kevin, thank you very, very much.
Thank you, Mr. Chair. Thank you.
Well done.
Commissioners.
Okay. That passed 11-0.